So let us discuss our first question, the gene that is affected in the fibrous dysplasia. So first of all, you should know what is fibrous dysplasia. It is a bone disorder that is characterized by abnormal growth. So there is abnormal growth and there is development of fibrous tissue in the place of bone. So in place of the bone you will see what? There will be fibrous tissue. In place of the normal bone you will see the fibrous tissue. So this condition it can weaken the bone. So that could lead to pain, fractures and deformities. So there are different forms of fibrous dysplasia. One is monostotic. The two types are, remember, monostotic and other is polyostotic. Monostotic means single bone is involved. Polyostotic when it affects the multiple bone. Now let us coming back to the gene that are affected in fibrous dysplasia. Remember COL1A1 gene mutation. It is associated with osteogenesis imperfecta. That is a condition that is characterized by fragile bone and frequent fractures. The other is GNAS1 gene. Yes, it is the gene that is associated with fibrous dysplasia. So your answer would be GNAS1 gene that is associated with fibrous dysplasia. The other is APC gene. So remember APC gene, it is associated with APC gene. It is related with polyposis, adenomatous polyposis coli. So that this gene will lead to polyp in the colon. So there will be high risk of colorectal cancer. And the last is SH3B2 gene. Remember SH3B2 gene, it is associated with cherubism. So your answer, the gene associated in fibrous dysplasia, it's remember the gene associated will be GNAS1 gene that is associated with fibrous dysplasia. Coming to the next question, a patient presented with following clinical features: down slanting palpebral fissures, zygomatic supraorbital and mandibular hypoplasia. There is malformation of ears, isolated cleft palate, and class 2 skeleton pattern with increased vertical proportion. So the characteristics, they are associated with syndrome that arise from neurocristopathy. So which of following it will show following features. So your answer will be mandibulofacial diastosis. The other name of mandibular facial diastosis is Tracker-Collin syndrome. So it occurs due to the mutation in the which of following genes. So remember that TCOF1 gene, POLR1C gene, so these mutations disrupt the normal formation of the bone and tissue in the head. So a patient with mandibular diastosis will show facial abnormalities, including underdeveloped cheekbone. So this the cheekbone will be small flattened cheekbone. There is small jaw, cleft palate, and the eyes will be downward and slanting. That's are the feature of Kraken-Collins syndrome. So downward slanting palpebral fissures, zygomatic, supraorbital and mandibular hypoplasia. Along with that, you will see malformation of ears, severe malformation of ears. All these would suggest mandibular facial diastosis. Other is cleidocranial dysplasia. So this one, the option B, the cleidocranial diastosis, it occurs due to mutation in RUNX2 gene. So which gene is associated with the cleidocranial diastosis? It is RUNX2 gene. So the RUNX2 gene, so in the cleidocranial dysplasia you will see absent collarbone. So this collarbone here is absent. There will be delayed or absent closure of frontalis on skull, short stature. These are the features. Third option is the Crouzon syndrome. So this one is the Crouzon syndrome. Crouzon syndrome, it is primarily caused due to mutation in the gene FGFR2 gene. So which gene? FGFR2, remember that for your exam. So there is abnormal head shape, flat head and prominent bulging eyes. So you can see these prominent bulging eyes. The mid face underdeveloped cause a sunken appearance in the middle part of the face. You can see acrocephaly here, tall pointed head, that's the feature, bulging downward slanting eyes, cleft palate, wide thumb, open fontanelles.